it's a very common thing, not just with DID, but I think with all complex trauma, for the container of the therapy session very rarely feels big enough. It very rarely feels, the session very rarely feels long enough. And I think that's one of the difficulties that we have, that, and especially if we're running kind of 50-minute, 60-minute sessions, it's a long way to go down into your trauma and then come back up again safely before the end of a session. And so I'm saying that because I think my starting point is the reassurance, first of all, for the client that there's nothing wrong with them for struggling to kind of come back to a place of green zone, safety, togetherness by the end of the session. It's a very normal, it's a very common occurrence. And it's a huge thing to ask of human beings who are distressed and traumatized and struggling, to say, come to therapy, start unpacking Pandora's box of all of this pain and all of this trauma, and then pack it away again on cue, right at the end of the session when the clock strikes, and hold on to it on your own for a week. So there's all sorts of different kind of facets that are kicking off there. There's the pacing of the session itself, and being able to kind of go down into the stuff and leave enough time to come back up again. There's the reenactment for the client of the feeling of abandonment when they're coming at the end of a session, and the unconscious ways that our attachment cry basically says, please don't leave me, please don't make me go. And then it's overwhelming at times. And it's this terrible, terrible feeling that you get to the end of a session, you're freshly made aware of the trauma that you've mainly been dissociating probably during the week. You've just brought it out into consciousness, you've got in touch with it, and then suddenly you are on your own again. And that being on your own is kind of so much the core of the traumatic experience itself. So the whole setup is a really tricky one to navigate, and that's nobody's fault. That's the nature of the trickiness of it. In terms of how you manage it, then what worked so much better for me than other things that had been done to me was, I found it so helpful for the therapist to talk to me about what I wanted to happen at the end of sessions where I was still in quite a distressed place. So I always used to have longer sessions, which helped enormously, but that didn't mean that I wasn't ever distressed at the end of a session. It did reduce it significantly, but there was many times where we've really gone there. We've done some brilliant work in the session. It's been a great session. But at the same time, you come to the end of the session and you're still so not quite grounded, not quite centered, not in the green zone. And sometimes it's just you've ripped a scab off and it is screaming with the agony of it. And so I was aware, in my front brain adult self, I was aware, of course I was, that the therapist had a certain amount of time allocated to me, and that she or he had either other clients or other things to do in life afterwards, and that I couldn't outstay my welcome. I knew that. Fundamentally, I wanted to cooperate with that. I think many, many clients don't want to be difficult at the end of the sessions. It's the last thing we want to do. We want to be good clients, most of us. We don't want to do anything that will annoy you, that will risk you rejecting us, risk you not working with us. So fundamentally, there are, that's not everybody. Anything that we say is never everybody, but I think the vast majority of people, that's the starting point. And so that's your kind of collaborative stance from the beginning of just explaining, but I think being really straightforward and real about it, and saying, I want to keep this space really safe for my clients, for all my clients, and that includes you, and it includes the client that come before and the clients that come after. So if our session runs over at the end, that's going to have a knock-on impact on other clients, and I wouldn't want that to happen for the client before, so that it knocks on for you. I think most of us as clients, we understand that we want to cooperate with that. I think where it goes wrong sometimes, and at the end of a session is that we don't have a plan in place for how we're going to do it. And the therapist's attempt to end the session and end it safely and end it calmly are at odds with what we need in that moment and what we've agreed. And so the more the therapist tries to end the session, the more we feel rejected and the more we feel abandoned and the more we feel misattuned to. And that then heightens our distress. So rather than us calming down, actually, the more as therapists you try and kind of calm us down, the more we get wound up by it. And so finding out what the experience of the client is. So, the first time it happens, follow up on that, the next session as well, and say, what was that like for you? Because that looked like you were really distressed when you left. I didn't want you to go in that distressed state. I wasn't sure what was helping or what wasn't helping. Obviously, because you were in a distressed state, your ability to communicate with me and to tell me what you needed was reduced. But now you're not in that place. Can you help me see what would work for you? And let's put some things in place that work for you. I think the message I always needed to hear was, it's not that I want rid of you, it's just that time is up.